So I want to introduce you all to my daughter. This is Vanessa. Vanessa was the type of kid that loved everybody. She was the type of person that if she saw someone collecting change on the street corner, she'd drive down to McDonald's, pick up lunch, bring it back, but she wouldn't just give them the lunch. She'd park her car, she'd get out, she'd sit down and have lunch with them and talk to them. Vanessa struggled at a very young age with mental health and later on through self-medication, substance use disorder. On January the 31st of 2015, she lost her battle with substance use disorder and died from an accidental overdose.
The U.S. Surgeon General has declared a youth mental health crisis. And while we wish there were a single easy solution, we know that it's more complicated than that. I've sat with countless parents across North Carolina like Randy who have lost their children to this crisis, and their hearts are broken. But there are people like Randy who don't want other parents to experience the same agony that they have.
As a parent, as a person who has a family member struggling with substance use, as a person who lost a close family member in 2017 to overdose, this is passionate for me. So as you can imagine, there's definitely a need in North Carolina for youth ages 12 to 17. We have about 41,000 people who have a substance use disorder. We've definitely had increases in overdoses, especially during the pandemic. In 2022, amongst youth, 22 fatal opioid overdoses.
Someone said something that literally made me just sit up and take notice that the nation's addiction crisis is a pediatric issue. And I thought, I don't understand that. How can that be? We know now that the longer we can delay that first use, the higher the percentages are that someone will not have a substance use disorder.
Delaying initial substance exposure or use in children and adolescents, I completely agree. We're also looking to raise public awareness on substance misuse.
This has been a really great conversation, but I think one of the things that I find in terms of kind of keeping track of what's happening and understanding the trends and having these conversations with our students, letting them know that, yes, while we see these CBD shops popping up all over and they have these bright neon signs and some of them are kind of taking this wellness approach, it still runs some of the very similar side effects and consequences.
I have 3 kids, and I know how hard it is for them and their friends to navigate the onslaught of challenges that they face. Addiction is clearly messing with our young people's heads. I was proud to help lead the National Bipartisan Coalition of State Attorneys General to take to court the big opioid drug companies that created and fueled the crisis that is killing our kids, first with pain pills, then with heroin, and now with fentanyl.
What are we supposed to do as parents? Don't run, call 911. Would you let your friend die? That's something that's very passionate to me. That happened with my daughter. The group she was with panicked. They did not dial 911 until it was too late. It's learning how to talk to your kids in bites.
Talk It Out NC. I think that's a really great series to utilize for age-appropriate conversations to help start those conversations with our kids. And again, it's age appropriate. So there are some that are set out for, under 12, and then another period from like 13 to 15 and so on and so forth up to 20 years old.
We do things like educational programs. You see Too Good for Drugs here and Halo, the healthy alternatives for young ones. We work with parents. You'll see the Strong African American Families program. We also work in our communities. We are members of coalitions. We work on strategic planning groups, plan take-back events.
These solutions and others will reduce demand for opioids by addressing addiction.
It's about protecting our future generation, like this says.
Our young people are facing incredible challenges, addiction being one of them. But as parents and as a state, there's nothing more important than keeping our children safe and giving them the best chance to succeed and thrive. In that process, we will build a safer and stronger North Carolina.